Afternoon, everyone. I hope you can hear me. All right, I see a couple of thumbs up. It is 5 o'clock on August the 14th, 2025. I believe that we have quorum. So I will call this meeting of the Durham County Board of Health to order. Hopefully everyone has had an enjoyable summer and ready to get back to work here with the arduous duties that we have as this board in this climate that we're in right now. So we have received the agenda and the minutes from the last meeting in June. Hopefully everyone has had an opportunity to review those. At this time, I will entertain a motion to approve the agenda as most recently disseminated. And yeah, so I'll entertain that motion now.
Motion.
Second.
All right, it has been moved and properly seconded. At this time, if there's any debate, we will hear it. Otherwise, we're ready to for the question, Donna.
Okay. Can you all hear me?
Yes.
Okay. Dr. McDougall,
Yes.
Dr. Ray,
Yes.
Mr. Brown,
Yes.
Dr. Glover, Mr. Gregorio, Dr. Jackson, Dr. Miller,
Yes.
Dr. Orto,
Yes.
Dr. Silberman, Commissioner Valentine, and Dr. Verbeest.
Yes.
Thank you.
Very good. So now that we've approved the agenda, we'll move on to the review and approval of the minutes from the prior meeting. I'll entertain a motion for approval or amendments if there are any.
Motion to approve.
Very good. Do we have a second?
Second.
All right, it's been moved and properly seconded. If there's no debate, Donna, we're ready for the vote.
Okay. Dr. McDougall,
Yes.
Dr. Ray,
Yes.
Mr. Brown,
You got a
Yes.
hand up,
I'm sorry.
Pam. You're
Dr.
muted,
Silverman?
dear.
Yeah, sorry, I apologize. I've been trying to play catch up because I got in a couple minutes late. Are these for the April 10th meeting minutes? Or was that the prior one?
It should be June.
June 12th.
June 12th. Okay, I thought I'd been to each of the ones and I'm not listed there if I'm seeing it correctly.
Okay. I can go back and add that in. I'm sorry if I missed you.
Sorry, I may be looking at the wrong document, so I apologize for that, if I'm wrong. And if I am, just ignore me. I apologize.
I
So-
believe the one sent out in the email was from April 10th. So you're correct, Pam.
I sent out April 10th.
Yes, ma'am.
Yeah, it says April 10th.
Yeah, and I see, and I'm not listed there, and I was there as well. So I just, I would appreciate it. I'm glad to approve the minutes, but just with that correction.
Okay. I can resend those out.
And I guess since we don't have the June minutes to review, we probably should not approve April again.
Okay.
So why don't we wait? We can table this motion until we have the June minutes to review.
Yes, sir, we'll do that.
Okay, very good. All right, so we'll move on to public comments. Donna, have we received any requests for public comments for this evening?
No, we have not.
Very good. So we'll move on to staff and program recognitions. I'll give the floor to our director, Dr. Rod Jenkins.
Good evening to this great board. Certainly echo the sentiments of the chair. Hope you all enjoyed your summer, and I'll be very brief. I just want to really continue to laud and lift up our dying team, who you will hear from a little bit later on. It goes without saying that they have been very hard at work, really advocating for their services and definitely promoting the work that they do, not only in Durham, but all over the world, all over the country, to be honest. And it's been a tough time for them. We share their sentiments and how they're feeling right now, given the current federal conditions. So we look forward to that presentation, and we thank them for their continued service. Also, to this great board, I'd like to lift up the leadership team of the Department of Public Health. It was, I believe, giving credit where credit is due, was, I think it was like Deputy Health Director Liz Stevens that helped me to realize that our leadership team has been together throughout the entire pandemic and really throughout my tenure as Public Health Director here in Durham, which is about 5.5 years. It goes without saying how much I appreciate them and their leadership, steadfast leadership, and I can count on them to really be subject matter experts in a number of different things. But to this board, I think it's only appropriate that I really commend them for staying the course, particularly during a very tough pandemic, and for just really being able to assist us as we continue to promote public health inside these trying times. That's all I have, Mr. Chair.
Thank you, Dr. Jenkins. And I see Dr. Silverman's hand up. Go ahead,
Yeah.
Dr. Silverman. You're recognized.
Sorry, since you're talking about sort of applauding your public health staff, given the horrific events this week or whenever it was a couple days ago with the CDC, I know the board has gone on record before saying what a wonderful job we think all of our public health employees have done during the Public Health Appreciation Week, but I would appreciate it if you tell them again how much the board appreciates all the work that they're doing, particularly in light of the recent violence on the CDC and public health in general.
Thank you so much, Dr. Silverman. I'd be more than happy to tell the entire staff that this great Board of Health supports them and it is behind them 100%. Thank you so much.
Very good. Okay, so thank you for those comments, Dr. Jenkins and Dr. Silverman. We'll move on to our administrative reports, and the first presentation will come from Micah Gwendon, and it will be a fourth quarter, 24-25 fourth quarter fiscal presentation. So we'll give the floor to Micah.
Thank you. Appreciate that. Good
Certainly.
evening, everybody. Give me one moment to get things going here. Okay, can you all see my screen okay?
Not yet.
Okay.
It's coming.
How's that?
Very good.
All right, great. Thank you so much. All right, board, good evening. I'm excited, even though we're well into August, but we do have almost complete data for quarter 4 of fiscal year 24-25. So that's what I'm going to share with you briefly this evening. We started our 24-25 fiscal year with a budget of $25,573,054. We did not have any budget amendments in quarter 4. So the amendments enrollment column here is the same that you saw last time I presented, quarter 4. We did ratify one budget amendment in our April meeting, but that went to the Board of County Commissioners in March. So that was counted in quarter 3. DPH ended the fiscal year 25 year with a budget of $27,020,100. Our expense budget is $38.42 million, excluding the benefits that the county keeps outside of the general fund. That is a 7% increase from where we started our year. And we have spent $33,938,573, or 88% of our general fund expense budget as of quarter 4. The budget categories that had the highest percentage of overall budgeted funds that were left unspent were in our salary lines from vacant positions generally. Our postage line, lab supplies, and miscellaneous supplies, but those latter three categories, of course, at much lower numbers than salaries. Personnel costs and miscellaneous contracts remain the top of our spending at the end of Q4. This chart shows those two categories holding steady, similar to Q3 at 96% of our spending. Some specific purchases from Q4 that I wanted to share are $6,267 of the Shingrix vaccine, which is the vaccine for shingles, $3,265 for lead paint test kits for community members. We spent $55,836 on 141 boxes of Narcan and $58,203 for 35 laptops for our Care Management for High-Risk Pregnancy program. I'm very pleased with where we are ending our year in terms of revenue. Our department brought in $11,662,849 in revenue as of Q4, making up 102% of the revenue budget. There were several divisions that brought in more revenue than was budgeted. So those included dental, general inspections, immunization, and STI. Most of that was from Medicaid revenue, but some was from private insurance as well. In environmental health for general inspections, there were grant funds as well as user fees. $5,574,287 from Medicaid was collected through Q4, and our grant revenue totaled $4,674,699. Those two revenue sources made up 88% of our department's overall revenue. Service fees ended the year at a little bit more than $500,000, $586,887. I wanted to highlight for you all the revenue that we collected from our state grants, or RAAs as we call them. That stands for Agreement Addendums. We were awarded 34 one-year grants in fiscal year 25. These are funds that would be lost at the end of the state fiscal year if they weren't pulled down. They're also reimbursement grants, so we first have to spend the money in order to get the money. So of these 34, which totaled $3.9 million, we collected $3.6 million in revenue, or 92% of those awards. Last year, that percent was 90%, and the year before that, it was 70%. So I was thrilled with the big bump last year, and now quite proud of this continued improvement and our incremental increases at this point. Our department has been granted $923,866 of the county's opioid settlement funds for 24-25 for 3 different projects. And at the end of Q4, we've spent 67% of our budgeted expenses for this year. As always, I appreciate each of you for your attention to the fiscal matters and look forward to transitioning to our new fiscal year. It's going to be an interesting time. So I really appreciate everybody's leadership, and I'm happy to take any questions that you all.
All right, well, I see Anthony Gregorio's hand up. So Mr. Gregorio, we recognize you this time.
Thank you. And thank you, Finance Director, Ms. Squinden. So the 300K that we expect to be remediated, when do you have a timeline on when that would be expected to come in? Is it going to be next fiscal year or this fiscal year?
I'm sorry, could you repeat the first part, the 300?
It sounds like we're still expecting 300,000 revenue. According to that, I believe it was the second to last slide. If you go back one more, yeah, it's at that
Okay.
or at least the remaining balance. Are we still expecting that through fiscal year 25?
We aren't, no, that's the amount that we were unable to draw down from our grants. Yeah.
Mhm.
So unfortunately, these are the ones, this list of 34, they're only 1-year grants.
Mhm.
We do have a couple of multi-years that would carry over. But all of the ones listed here. So unfortunately, we won't be able to collect those. Most of that comes again from vacancies
Mhm.
and positions, and then a couple of timelines that get difficult for us to spend the funds in the timeline that's given. So those are some things that we're always kind of working on to try to, make this 100%, but we're slowly getting there.
Gotcha. Thank you so much.
You're welcome.
All right, I see Dr. Silverman. We'll recognize you. Dr. Silverman, you're on mute.
Thanks.
Mhm.
Do any of our revenues that we get in or budget that revert at the end of the year if we haven't spent it?
Not that's listed. No, not really. Because of in terms of the budget, the county fiscal year just does a 12-month fiscal year. So, we re-up. So where we've gone over a little bit, 102%, we made some tweaks. So for next year, but it doesn't carry over from year to year.
So I can't remember which slide it was. It looked like we spent 88% of what was budgeted this year so far.
Yeah, on the expense side.
Right. Are any of the money that was budgeted gonna go back to the county because we haven't spent it this year, or how does that actually work?
Yes, yeah, on the expense side, so the difference here would revert to the county, yes.
Okay.
And they do, from what I understand, they do count on not just from us, but from, all departments, they count on a certain, especially from lap salaries, count on a certain portion of that. But yeah, the difference there goes back to the county.
So we don't end up with carryover funds is what that's what thank you.
No, yeah.
Thanks.
No problem.
All right, do we have any other questions for Ms. Gwendon? Well, Micah, as always, we thank you for your detailed reporting on the finances for the department. And
thank you.
Yeah, we appreciate it. Thank you. Just a quick aside, Ms. Murphy has sent out the correct minutes, the June minutes, but we'll give you the opportunity to review those at your leisure and not necessarily during the meeting, during the presentations. So we'll still table that, the approval of those minutes for the October meeting. Okay, we have our next presentation from Dante Hart. I think I'm pronouncing the first name properly, as a representative of the DINE program on the Innovative Nutrition Education Program specifically. So give the floor to Dante at this time.
All right, good evening, everyone. Can you all hear me okay?
Yes, sir.
Excellent. Let me just share my screen. Just a moment. That. What I want to share. Can you all see screen?
It's coming. Yep, there it is. Yes, sir.
All right. Wonderful. All right. Well, good evening, Board of Health and everyone in attendance today. Thank you for allotting time for this presentation. My name is Dante Hart. I'm a registered dietitian and nutrition educator. I, along with my colleagues and our program managers, Morgan Metters and Kelly Warnock, are all registered dietitians, and we come to you all this evening representing the DINE team. As many of you know, DINE stands for Durham's Innovative Nutrition Education Program, and we're housed here in the Nutrition Division at DPH. I'm one of the newer additions to the DINE team. I started a little over a year ago. However, some of my colleagues have been here much, much longer, with our longest tenured Dyne team member being here in the county over 19 years. And the team has over 80 years of combined experience working at DPH. So today I just want to tell you a little bit about our program, a little bit about what we're going through right now, and how you all as the Board of Health can assist us. Next slide, please. Okay. So the Dyne program has existed for over 25 years, 26 to be exact. If Dyne were a person, to be old enough to kick it off their parents' health insurance. But in that period of time, Dyne has become an integral part of Durham County, impacting many areas from schools to senior centers to farmers markets and more. I have some numbers on a later slide to quantify some of that impact. But we just don't teach nutrition and do cooking demos, although really good at that. We do engage and spearhead important policies, systems, and environmental or PSC work that ultimately empowers the residents of Durham County by equipping them with the tools they need to help them live a healthier life. An example of such PSC programs is the Double Bucks program. And for those that are unfamiliar, that program allows Durham County residents to participate in food assistance programs like SNAP and WIC to double their money when they use their EBT cards or cash at local farmers markets. This helps increase access to healthy foods throughout Durham, and it also supports local farmers and growers. Next slide. And here's some photos of the Dyne team in action. You often hear the saying, you got to meet people where they are when it comes to challenging and changing health behaviors. The Dyne team literally meets the community where they are, whether it's in schools, senior centers, parks, or libraries. And I have a short clip that I want to play. We can get the audio going. Make sure we got that. Let's see. Can you all hear that? No.
No, sir.
Let's see. We have to skip the audio. I don't see an option to share audio, so we're just going to have to forego that, unfortunately. So we did have some audio clips to play, but had some technicals, but it's okay. We're fine. Next slide, please. All right. So quick flashback to last month. While most people were enjoying cookouts or families during the July 4th holiday, our team spent the holiday and weeks leading up to it very nervous and anxious because of HR 1, also known as the One Big Beautiful Bill Act, which was signed into law on July 4th. That bill eliminated all funding for the Nutrition Education and Obesity Prevention Grant, known as SNAP-Ed, effective fiscal year 26, which we know is October 1st. And since the Dyne program was funded in large part by that grant, we were heavily impacted by HR 1. And when I say heavily impacted, let me be clear. The reality of the situation is that unless we secure alternative funding, the Dyne program in its current form will cease to exist after September 30th. And the last I checked, that is 47 days from now. I do have a bit of good news. The good news is that Dyne won't be completely shuttered. 4 staff are currently funded by Durham County and will stay on board to continue the work. However, those 4 people will have to now somehow do the work of 17, and that's simply asking them to do the impossible. So as implied, that means that there are 13 Dyne team members whose positions are being eliminated. And just let this sink in. I'm not just talking positions with a 5-digit county ID. These are 12 highly qualified registered dietitians and an invaluable processing assistant who bring a wealth of knowledge and experience to Durham County Department of Public Health and to the diverse residents of the county as well. And most importantly, these positions are people with families and livelihoods that are about to be upended after September 30th. And that includes me too, all right? So while it's very tragic to know that some of us will be losing our jobs, the biggest tragedy is what our Durham community is going to lose. Next slide. So what is our community set to lose? Well, because my job involved teaching nutrition in middle schools and to adolescent audiences, I naturally have to start there. DPS schools do not receive this level of evidence-based nutrition education. Dyne is oftentimes the only source of nutrition education students receive throughout their DPS tenure. And we make sure that children from preschool all the way through middle school are exposed to new foods and flavors and know about foods they need to live a healthful life. And many of these students also share what they've learned with their families, further influencing household dietary and behavior changes. On the teacher side, the teachers often rely on Dine to come to their classrooms and teach nutrition, helping students make the connection between what they eat and what they are learning in their science, health, and PE classes. And some teachers literally plan their year with us in mind. Also, our older adult community looks forward to Dine coming into their senior living facilities and centers to teach and to cook a delicious meal. And they may not get such programming come October. Next, the Double Bucks program, which I mentioned earlier, will no longer have a dedicated Dine position to serve as a liaison. That means the work that will have to fall upon the remaining county funding staff will already be shouldering an increased workload. And because Dine was grant funded, we provided these services at no cost to our partners. So that may have to change moving forward. Speaking of our partners, next slide. And so while the previous slide contained many numbers, however, the most important numbers are the number of partners who work with Dine that we won't have the capacity to serve. Here are but a few of them you see on the screen here. And I just want to note that anytime you see both Carolina and Duke on the same slide, you know it's something special, all right? So from large to small, community organizations to universities, Dine has established and cultivated very fruitful relationships throughout its 26-year history. Next slide, please. So Dine Reimagined. So the I in Dine stands for innovative, right? And we know that the Dine of the past can and will no longer exist after September 30th. However, even in the midst of this situation, we continue to work and think of ways to serve Durham County, given the circumstances and expected resources available. So this reimagining of Dine is a testament to that innovation. The team is doing its best to leave no stone unturned with regards to funding and finding a way to exist. We meet every week to look at grants and figure out ways we can, continue to keep this program rolling. The Department of Public Health has located some funds, and we're awaiting an update from Manager Hager and the Board of County Commissioners with regards to potential county funds that may be allotted to Dine. So we're very grateful and appreciative of the support from Dr. Jenkins and everyone here at the Health Department, as well as the Board of County Commissioners for their assistance with this. But the reality also is that even if these funds come through, it won't be enough to maintain the entire team in its current form. And although there are a lot of cons with regards to restructuring Dine, there are several pros that do provide somewhat of a silver lining. So the first pro is that because Dine will no longer be federally funded, we'll have a little bit more autonomy as pertains to who we can reach, because previously we were limited to populations utilizing SNAP. Moving forward, we'll be able to serve more of Durham County, although our reach will be limited due to less staff. Second, we'll be better able to adapt to the needs of the community rather than having to operate based on SNAP Ed guidance. And during the Board of County Commissioners meeting on August 4th, which was last week, members of the board suggested a few courses of action, including reaching out to the County Department of Economic Development and potential funders. And I can confidently report that we have swiftly moved on those suggestions. So to the Board of Health, what do we ask of you? What we would love for you to do is talk about our program wherever you are. If there are any opportunities for funding or resources, please keep us in mind. Also follow us on social media and share our stories. Our Instagram handle is @dine.nutrition. Forward any leads that you may know or come across, and truly any effort helps. And although we're asking you for this level of assistance, just know that our team here is doing all that we can humanly do to keep this program rolling at the highest capacity possible. As I've told people in conversations about Dine, we will continue to do what we do best until we cannot, because our team remains creative and we will always think outside of the box. Next slide. And here, wrapping up, we have some additional photos of the Dine team in action, teaching about healthy eating, gardening, engaging students in physical activity, and leading hands-on culinary sessions, which I will say are the kids' most favorite part about Dine lessons. We did have a clip, but our audio is not working, so we're gonna forego that. And so as a wrap up, I wanna share a personal story with you all. So I interned with Dine in summer 2017 as a graduate student at UNC, go Heels. In fact, Kelly Warnock was my preceptor. I love my experience here. And 7 years later, as I was applying and interviewing for this position, I saw most of the staff that were still here, and that was a positive sign for me. It was positive because it showed me that the people on this team love working here, and they love serving the residents of Durham County. And from my interactions with those across the community, they let me know that the feeling is mutual and that they love Dine. So regardless of what the future holds, I can truly say that it's been a privilege to serve Durham County as part of the Dine team. So I thank you all for your time. I hope that this short glimpse into our work has provided further insight into what we do and the impact that we have had in Durham County thus far. So from now, my colleagues Morgan, Kelly, and I will now field any questions that you may have.
I don't see any hands yet. I did have a question to Mr. Hart and perhaps to Dr. Jenkins. I know that you're looking at other sources of revenue or funding for the DIE. Nate, can you share with us? Yeah, somebody can go on mute. To date, can you share with us any updates on alternative revenue sources or funding sources, and maybe how many of the Dine team positions we might be able to maintain above and beyond those 4 dietitians?
Thank you so much for the question, Mr. Chair. And, to Adante, job well done on the presentation as always. I will say this, as I've expressed to the leadership team, executive team, and to the Dine team, has been my #1 priority over the course of the months since we've received the official word of House Bill 1. We continue to work with the county manager in our efforts to reimagine, but most importantly, in our efforts to retain this great team. There is a huge exercise going on now throughout the county as directed by the county manager to all department heads, particularly those departments that may be affected by the federal funding cuts. We continue to work with, with human resources to see what options are available. We've done a number of things like determine whether or not anybody from Dine can be mapped into environmental health. We also have additional funding, which this great board will approve, that will allow us to retain some staff. The fact of the matter is there are a number of different proverbial holes to plug throughout the enterprise that the county manager has been doing her best to tend to. So it's kind of hard to really give you a definitive answer. But as Adante indicated, on August 4th, we did receive a more positive note from the Board of County Commissioners indicating that they understand the value of this program. They want to do everything they can to retain some semblance of this program. 13 positions might be a little tough of an ask. So I think right now it's looking favorable that probably 55% of the program can be salvaged. But we are certainly hopeful that, something can happen. We are holding out for the whole team, but honestly, to this great board, it's not looking that favorable. But again, we're still looking for partners. We met with the budget director on yesterday, and we indicated that this is a division that can generate revenue. So we will look for other ways that they could probably bring in revenue to sustain members of this team. Nothing is off the table, Mr. Chair and members of the board, but as it stands right now, we are still in a holding pattern until maybe another 2 weeks when the county manager is going to come above board with her final decision. I hope that answers your question, Mr. Chair.
It does. Thank you. I know you're trying, and that's really, it's encouraging to hear that it, approximately a little better than half of the team might be able to remain. So but we trust that you will continue to look for those alternative funding sources.
Absolutely. We do have a couple of hands up, Mr. Chair.
Oh, I see. Okay, I'm sorry. Dr. Glover, will recognize you first. You're
Thank
muted.
you so much, and good evening, everyone. Adante, fantastic job, my friend. I don't recall all the logos that were on that slide where you had your partners, but I'm curious to know, have you partnered with any grocery stores or any food manufacturers outside of farmers locally in the Durham area? Because there are a ton of grocery stores and a lot of companies coming into our area. It'd be interesting to see if any of these organizations would like to partner with you guys with potential grants or something like that to help to continue to push the initiative forward. So I was just curious to know if you've tried to partner with any large major grocery store chains out there.
Great question, Dr. Glover. And I've only been here for about a year, so I'm going to defer to Kelly Warnock, who has been here much longer than I have and could probably speak better to that.
It's a great question. And yes, please bring all these ideas because I'm like, ooh, that's a great idea. We have partnered with 2 grocery stores that have closed, Los Primos and I'm forgetting the other grocery store that was right by Los Primos. We do work, yes, Save a Lot. So we partnered really closely with them. We have worked with Food Lion, but kind of tangentially because Food Lion ran a program there that a different agency partnered with, and we worked with them. But yeah, we could reach out because I know a lot of grocery stores pre-pandemic were working with dietitians to do like grocery store tours. So we can definitely reach out and see if anyone would be interested in that. We did we have a meeting today with Duke Pediatrics, just like a preliminary, let's like talk and see, just seeing if they would be interested in having any of their clients come to our classes and maybe contract with them as well.
Thank you.
Thank you. Mr. Gregorio?
Thank you. And thank you, Ms. Warnock and Mr. Hart and the team for your amazing contribution coming from Dine. Mr. Hart, you had mentioned that you all are on Instagram. This is my only personal ask. If you could perhaps make a post on Durham Public Health's page or something for me to share on LinkedIn. I tend to be a little more active personally with my network on LinkedIn, and certainly, hopefully, we could find more opportunities for you all. And secondly, go Duke.
I won't speak to the second one, but I will say that that's a great idea to make things for LinkedIn. So our team will work with Dr. Jenkins and Dr. Alicia Smith, our communications director, to work on that. So thank you for the suggestion.
Thank you. And I'll certainly tag you all.
Thank you.
All right, I don't see any other hands. We certainly, again, thank Mr. Hart and the rest of the Dine team. We're praying for you guys and hoping that things turn out better, but we certainly appreciate all of your efforts.
Thank you. We appreciate it.
Yes, sir. Okay, we're moving on. We have our public health vacancy report that we can review. We'll let Dr. Jenkins just quickly go over that with us, if you don't mind, Dr. Jenkins.
More than happy to. Again, Mr. Chair, we can, real briefly, I will just say, I have said to several members of this great board that we are in the process of reimagining that vacancy report. We certainly want to make it a little bit more streamlined and easier to read, as it kind of goes to a historical perspective of our vacancies. So that is something that Ms. Murphy and Representative Holmes from our HR division is going to work on. But we continue to hover around 12% with a couple of dips down. And that is indicative and representative of the vacancy rate for the entire county. Some months are better than others. I think we had a good month in June and kind of crept up in July, but I will just say we're holding steady. Durham Public Health continues to be the employer of choice. We have some superstars who are coming on board and enhancing all our divisions. So we are definitely happy about that and look forward to highlighting those individuals in the near future.
Very good. Thank you, sir. Any questions regarding the vacancy report from the board or the rest of the attendees of this meeting? All right, seeing no hands raised, we'll move on to our NOV report. We'll give way to Mr. Salter.
Yes, sir.
Salters. Yes, sir.
There
Thank you.
are, since June, it appears that we added 5 and were able to remove 4. There is one that's a little different this time on the compliance list that may have caught some attention. Line 39, you can see it says rescinded. In the comments, you see that EHS, Environmental Health Specialists, used ground penetrating radar to confirm a failing system and determine that it was a discharging sand filter. That type of system is not within our jurisdiction. It's a DEQ system or DWR. So we reported that to them and took it off of our list, and then they're supposed to address the NOV. I'm happy to point out too that the GPR, ground penetrating radar, is a piece of specialized equipment that we picked up a couple of years ago and really enhances our ability to look at things like this. This is a really old system, and sometimes it's really difficult to tell exactly what type of system it is. And having that piece of equipment enabled us to really pinpoint that it was not even our type of system. It wasn't a true health department system. It actually belongs to the state. And so we're able to get it off the list and turn it over to them. There is one other thing. One of our oldest NOVs, I believe it's line 8, yes, 3913 Cheek Road. We're in processes of taking some legal action on that. And I believe Attorney Malott will weigh in on where we are and give us an update on that.
Yes. The property owner, there are actually 2 property owners, and they have not communicated with the health department at all, despite numerous attempts. And so we did file a complaint against them to try to motivate action and served them with the summons and complaint. And they reached out briefly and then sort of faded away again, and have not filed anything in the action. And so we did seek entry of default, which is an automatic thing that occurs in court upon motion that we filed. And it essentially is the court's way of acknowledging that they haven't participated in the lawsuit at all. I sent them a copy of that document and asked them yet again to please interact with us, because the goal really is just compliance, and gave them a deadline for replying or contacting us in some way, provided the number to reach out to, and they have not reached out at all. And so I think we're probably going to need to take the next steps of asking the court to enter a judgment against them, and then asking the court to hold them accountable for seeking a connection to the city's sewer, which in this case, I certainly, Mr. Salter, speak to this, please. But my understanding is that's the best possible outcome in this situation. And so I think the goal really is compliance. And I think we've been over backwards to try to get them to engage and to comply. But it's time now to ask for the court's assistance.
Thank you, Attorney Malott. I wanted to ask Mr. Salters, I'm not sure if you're done with the report, but the surfacing fluent, does that mean what I think it means?
Yes, sir. That's what an NOV typically is. It can be, I think we've discussed this in the past, some systems require a certified operator, and sometimes an owner will not engage or contract with an operator. And so those are not as critical because you don't have a discharge of effluent, but surfacing means that effluent is coming up to the surface and ponding. And so. Yeah.
Gotcha. All right. And just for my edification, about how much what's tying into the sewer system, about how much of a financial burden is that on the owner?
It's changed a lot in the last few years. There used to be a formula, and I haven't recently talked to the city about what they're charging. They've got a different way of addressing this now, but it used to be $2,500 plus $50 per road front footage. So it was really determined on how big the lot was. It can be quite expensive, but
Mhm.
you know, that's not in our purview. We can't do much about it.
Sure.
And also, you know, it has to be, a lot of times municipal sewer is not an option because it's not close enough. But
Right.
yeah.
And I will add, because I think it's probably helpful to know that in this situation, at one time, I'm not sure what the most up-to-date information is, but we believe that this house was being rented out and not the primary residence of the property owner, which I think is at least helpful to know.
Sure.
Yeah.
Sure. Thank you. Thank you.
Thank you.
Do we have any other questions, for Mr. Salters, regarding the NOV report? We appreciate you both, Mr. Salters and Attorney, a lot for the information. We'll move on with the Health Director's report for June and July of 2025. We'll give way once again to our Director, Dr. Jenkins.
Thank you, Mr. Chair. And I will again be brief. There's always a great challenge in which one did I really highlight. And I will say, surprisingly, we did receive a number of entries in reference to the great work that goes on in environmental health under the leadership of our superb environmental health director, Mr. J. Chris Salter. I definitely want to lift up the fact that we in Durham County have over 350 swimming pools that have to be inspected in order to be ready for the summer season. We do have a team that is definitely spearheaded by Whitney Gaither, who's one of our environmental health specialists, who does an excellent job. She's been with us for quite some time, and I almost always receive positive notes of thanks to Whitney, who goes the extra mile to ensure that folks are in compliance. She just has a very nice touch when it comes to ensuring that people are in compliance with their swimming pools. So I certainly wanted to lift that up. And then, of course, Chris has been ahead of the curve for quite some time in his partnership with the city's GIS division in an effort to leverage technology to do inspections and to do the work that we do. I think for when I first got here, Chris was telling me that they have been utilizing GIS to map out different areas and plots of land that really coordinates their efforts as far as inspections are concerned. I know that's something that may seem novel now, but again, I know Chris can speak to it a little bit more eloquently than I do. But we definitely wanted this board to know more about it because it certainly helps us to do our work a little bit better. But with that, those two programs in environmental health, I certainly wanted to highlight and really let you all know that we're continuing to use and leverage technology along with just real good old-fashioned customer service skills to do a better job with public health. Happy to answer any questions you may have.
Don't see any hands up yet, so I'll ask a question with the first. I'll let you go ahead, Anthony. Yeah, I'll recognize you. Go ahead, sir.
Thank you, Dr. McDougall. And thank you, Dr. Jenkins, Director Jenkins. This is certainly tied in with my ask, from last time talking about the seasonal public health issues such as swimming pools. I find that very fascinating that as I did review your notes that you had data scientists create a dashboard using SQL and Python. It's really in depth. I think that's really awesome. Actually, we'd love to see a dashboard if that's at all possible. If you could share that.
We'll be more than happy to do it.
Really kind of nerding out on that. I appreciate it.
We'll be happy to provide you with this board, with that dashboard. We are fortunate, again, to have John Paul Zita, goes by JP, who is our data scientist for the agency, and he is second to none. I try my best to brag on him as much as I can because he is a brilliant mind that helps us by not only developing dashboards for us, but his work is also extended to universities, to the city of Durham, to a number of different areas. So again, leveraging technology, having public-facing dashboards to really let our community know about public health.
Okay. All right, very good. I did have a question as well regarding the mental health first aid. Make sure I'm using the right terminology. The mental health first aid training. I see that for the adults and for youth training, it's a 7.5 hour in-person course. Is that, first of all, first question, is it a 1-day course? And for either adult or youth? And then is that open to the entire community? I kind of got the impression that it was, but if it is there any sort of prerequisite training in mental health counseling that is required of participants for that additional training, that 7.5 hour training course?
To my knowledge, you are correct. It's open to the public. It is a one-shot deal, 7.5 hours. I haven't gone through it myself. I do know that there's no prerequisite for mental health training, formal training, anything like that. So yeah, I mean, it does not require any prerequisite training. I think I addressed all your questions.
Yeah, and so then I have one follow-up. Is there a posting of where future courses might be, when and where they might be offered? And if you don't have it today, that's fine, but
more than happy to get that answer for you. I don't know where we posted, but I'd be more than I'm more than sure that it's on our website. Of course, to the listening audience, we beg your forgiveness and your patience. We do have a brand new website that we've converted to that has a lot of bugs in it right now, but we're doing a good job. Big shout out to our PIO, Dr. Alicia Smith, who has been hammering away and trying to organize everything. But with that, most of those opportunities are certainly on it, on the website. And again, I think Lindsay was kind enough to let me know that all the information is correct, except for there are no current events on our website. So she let me know. As mentioned, the website is definitely under construction. It's posted forward facing, but we are definitely getting it more organized and streamlined like we used to, Mr. Chair.
Thank you, sir. I see a hand up. Dr. Verbeest will entertain your question.
It's a comment. I am a mental health first aid instructor, and I'm thrilled that you're offering that in our community. It's a really wonderful way to really upscale our community's capacity to respond and to support each other. So good job.
Awesome work.
And, again, in talking with the executive team about our goals for fiscal year 25-26, we did say that we wanted to kind of ramp up our efforts to provide mental health to the community. So more to come. We do have a couple more things that we're going to investigate. We do know that we are under a mental health crisis, particularly with our teens, and public health certainly wants to do our part to make sure that we provide resources for the community.
Thank you. All right. I don't see any other hands up regarding our health director's report, so I will move on through the agenda. We don't have any committee reports or old business posted on the agenda, so we'll move on to the budget amendments in our new business. And once again, we'll give way to Dr. Jenkins for a presentation of those budget amendments, those 5 amendments.
Thank you so much. The board is requested to approve budget ordinance amendment to recognize funds in the amount of $13,826 from the North Carolina Department of Health and Human Services Division of Public Health Epidemiology section of the CD branch. These funds are going to be used to support activities associated with the number of refugees arriving in Durham County, which has exceeded expectations with an increased number of screenings for a total of 880 screenings. The next one, the board is requested to recognize $212,893 from NCDHHS Division of Public Health. These funds are used to recruit and retain highly qualified staff to support foundational service areas and core functions of Durham County Public Health. The next one, the board is requested to recognize $17,500 from the CD branch of the North Carolina Department of Health and Human Services, Division of Public Health. These funds are an amendment to an existing integrated targeted testing services grant provided through the Communicable Disease branch of NCDHHS. The additional $17,500 in spending supports expanded HIV prevention efforts, including targeted education testing and referral services during hours accessible to individuals with the highest risk factors. The next one, the board is requested to approve budget ordinance amendment to recognize funds in the amount of $3,200 from the North Carolina Department of Health and Human Services, Division of Public Health, Chronic Disease and Injury Section, Cancer Prevention and Control branch. These funds provide funding for our breast and cervical cancer control program to help support activities associated with breast and cervical cancer screenings. The target number of screenings has increased to 55. And finally, the board is requested to approve budget ordinance amendment to recognize additional funds in the amount of $9,081 from the North Carolina Department of Health and Human Services, Division of Public Health, Epidemiology Section, CD branch. These funds support local health department, STD, HIV care and prevention, partner services, and surveillance activities, all in an effort to control the spread of HIV STDs by providing case investigation and contract services. That is all, Mr. Chair.
Thank you, Dr. Jenkins. Do we have any questions regarding these 5 budget amendments? In my view, I don't see any hands up, so I will entertain a motion to accept all 5 at this time.
Good.
Okay, I think we have a motion to.
And I'll second it.
All right, it's been moved and properly seconded that we accept all 5 of the presented budget amendments. If there's no debate, we are ready for the vote. Donna?
Okay, Dr. McDougall,
Yes.
Dr. Ray,
Yes.
Mr. Brown,
Yes.
Dr. Glover,
Yes.
Mr. Gregorio,
Yes.
Dr. Jackson, Dr. Miller,
Yes.
Dr. Ortel,
Yes.
Dr. Silberman,
Yes.
Commissioner Valentine, Dr. Verbiest.
Yes.
Thank you.
Very good. All right. So for the next meeting, our October 9th meeting, we will hear any suggestions for content or presentations for that meeting. If you have anything, board members that you'd like to, any departments that you'd like to hear from, any topics that you'd like to hear about, we'll entertain those subject matters at this time. Okay, well, we'll allow for our director and his staff to develop an agenda for us and presentations for us for the October meeting. Keep in mind that when we begin our meeting in October, we will be ready to approve both the June meeting minutes and the August meeting minutes at that meeting. So please review the June meeting minutes that have been sent out already. All right. Do we have any informal discussion that we'd like to have at this time? Nope. Okay. Well, we're almost an hour in, so I will entertain a motion to adjourn.
So moved.
All right. And a second by Mr. Gregorio. All right. So it's been moved and properly seconded. If there's no unreadiness, we're ready for the vote.
Okay, Dr. McDougall,
Yes.
Dr. Ray,
Yes.
Mr. Brown,
Yes.
Dr. Glover,
Yes.
Mr. Gregorio,
Yes.
Dr. Jackson, Dr. Miller,
Yes.
Dr. Ortel,
Yes.
Dr. Silberman,
Yes.
Commissioner Valentine, and Dr. Verbies.
Yes.
All right. Thank you, everyone, for your time and your comments and questions. And we will see each other again in October.
Bye.
Enjoy the rest of your summer. Thank you.